In this video, I'm going to discuss what to expect after the first 2 courses of Lemtrada. You get your 5 days, wait a year, get 3 days, and then what happens? If you'd like to hear the answer, stay tuned, because that starts right now. Howdy. Thanks for learning about MS with me, Aaron Boster. I started this YouTube channel to help my own MS clinic patients learn between visits, and it's my hope that through these videos, I can help you learn too. Before I jump into today's topic, you might be asking, why am I in a car? Well, I'm dropped my kid off at a piano lesson, and so I'm waiting outside for the half an hour. And I've seen other folks on YouTube do this, and I thought I wanted to try it out too. So let me know what you think in the comments, if it makes any sense to deliver a discussion about neuroimmunology while waiting in a parked car. At any rate, today I want to talk about Lemtrada. This is a disease-modifying therapy taken through the vein, and it's given in an unusual manner. Now, I'll throw a card up above and include links down in the description below in case you want to check out other videos I've done on this drug. But today I want to talk about something in specific. You get 5 consecutive infusions, so IV infusions Monday, Tuesday, Wednesday, Thursday, Friday. Then we wait a year, 12 months, and then you get 3 infusions, Monday, Tuesday, Wednesday. After that, what comes next? And that's really what I want to focus on in this video in a car. We typically see our patients every 3 to 6 months, and we move forward in time. Now, of course, you need to continue the REMS lab, the monitoring labs. And so, again, once a month, every month, for 4 years after your last dose, you're going to be visited by the nurse ninja who's going to draw your blood and urine so that we can make sure that we're keeping you safe. And so one of the expectations is that you're going to have ongoing lab draws for 4 years after that last dose. So the way that we do things, at least where I work, is 6 months after your second course, we obtain a new MRI of the brain. And we refer to this as the re-baseline MRI. And a good analogy might be, if you were an okay or a poor speller in 3rd grade, when you start 4th grade and you take your first test, spelling test in 4th grade, that's the one that the teacher uses to base the rest of the year off of. He or she doesn't go back a year and look at what you did in 3rd grade. So similarly, we're going to call in a scripture a new re-baseline MRI 6 months after you receive Lemtrada. We typically image people after that re-baseline MRI once a year. And so the typical cadence of events is seen in clinic every 3 months, MRI once a year, and lab draws every month for 4 years. If along the way we are to have a new MS attack, or along the way we have 2 new spots on an MRI, we would have a discussion about breakthrough disease. And typically the discussion sounds like this. Do we A, watch and wait, which me personally is not typically what I want to do. When I see activity, I want to act on it, but that is an option. A second option is to give a 3rd course of Lemtrada, so 3 more days of Lemtrada. And this is now approved in both the European and the American labels in situations where there's breakthrough disease, as I've described. The third option would be to switch drugs. And the discussion of do we get another course of Lemtrada or do we switch drugs typically is a review of how the patient's done overall. If we had someone, let's say, with active disease, and they went through two courses on Lemtrada, and then they had really quiet disease for a long time, and they had 1 attack, that's a patient that we're more likely probably to re-up and give a 3rd course of Lemtrada. However, if a patient had attacks during Lemtrada, right after Lemtrada, they had disease activity on MRI, we never really fully brought things down and made things quiet, and then they have an attack, well, this might be someone in whom we would consider altering therapy or switching therapy. Before I sign off, I also wanted to talk about the likelihood of needing a 3rd course. So based on the statistics from the phase 3 trials, this is the CARE-MS1, CARE-MS2 trials, we now have data in clinical trials patients going out 8 years. And so, you take your first course Lemtrada, a year later your second course, that's year 1. We have 7 years down the line. And so we can answer the question, what's the likelihood that you're going to need redosed? So when you look 8 years down the line in the clinical trials, 55% of patients never needed a 3rd course. So they got the first 2 planned courses, and then they went 7 years out and never had another attack or 2 new spots, which would merit being retreated. And that's kind of awesome. Now, 30% required a 3rd course. So 30% of the patients got the first 2 courses as described, and then in the subsequent 7 years had some type of disease activity which led to getting another course of Lemtrada. And I think it's about 12.5% got a 4th course. And so when you finish your first 2 courses of Lemtrada and you're looking down the line, there's an 85% chance that either A, you're done being treated for that period of time, or B, you're going to require 1 more course. Once again, my name's Aaron Boster, and thank you for taking a few minutes to learn about MS with me, particularly tonight since I'm recording this in a car. If you liked what you saw and you think you might enjoy more content from me, please consider subscribing to the channel. And as always, I would love to hear your comments and questions, so please leave that in the section down below. Until my next video, take care. Lemtrada.